It's so good to be here with you and to be the second speaker to say many of probably of the same things that we want to share about what's impacting our industry. I'm with the nonprofit industry. I was at a meeting one time and I heard a nonprofit executive say, you know, I run my nonprofit like a business. And I was very disappointed to hear that because we are a business. And so that's why I was invited today, is because nonprofits are our business. We just allocate our profits in different ways instead of with shareholders, the owners. We give it back to the community, and like Mary Washington Healthcare, our mission is to improve lives. By mobilizing the caring power of our community. As I look around this room, so many of you are part of that mobilizing. You give, you advocate, you volunteer for United Way, but also so many other nonprofits. And we need you more than ever. In 2019, we sat down and we created at United Way a Be Bold plan. We were going to change the strategy because our environment had changed, and we were so excited about the changes we were bringing, and we put it all together. We were bringing some programs in-house, and that was exciting. And then COVID hit. And that Be Bold plan was more important than ever before. We didn't realize it because we were bringing in-house rent and mortgage assistance, transportation assistance for Alice. Those are individuals who are asset limited, income constrained, employed, those who are working hard, but one blip in their life causes a lot of tragedy or hardship in money. And so we actually benefited from that from a grants perspective. All of a sudden there were COVID grants, there were American relief programs, and we were heavily supported by our local governments, especially Stafford and City of Fredericksburg. We did over $2.6 million in rent assistance in 2020 to 2022. And that was so exciting. But what wasn't exciting is the change of the environment, because United Way, we focused on workplace campaigns. And we go in and say, you gotta give, and we'd sit here just like with you all and give you pledge cards, and then say, and on Fridays, if you give, you can wear jeans. Well, these rooms were empty during COVID. They were all virtually, and if you met with them, they were just black boxes. And I couldn't say, give, and you'll get to wear, give, and you'll get to wear jeans on Fridays. Because I couldn't monetize pajama bottoms, right? So the whole landscape changed for nonprofits, United Way especially. It was harder to get to the people, and if you can't get to the people, how do you get the donations? So that was really hard. So on one hand, grants increased, which was phenomenal, but they were also limited grants. They weren't renewable. So by 2022, those grants were gone. And those employees, as we anticipated, this was odd, and I think a lot of nonprofits expected, well, in 2022, they'll all go back to work. But they haven't gone back to work. They're working differently. Just like Dr. McDermott has explained, they're all working differently. So I think that's a struggle for our industry, is we are having to think and work differently in the nonprofit world. We're having to try to figure out how to connect with our clients differently, how to connect with our donors differently. You know, we all have been through the Great Resignation and now through the Great Reshuffle and trying to figure that out. I've worked the last 6 months with only 2/3 of the workforce that I need at Rappahannock United Way in order to get the work done. And I know a lot of nonprofits, when you say, hey, how's it going? What's your #1 focus right now? And they're like, hiring. Do you know of anybody that's looking for a job? So that's a big piece for us, is hiring. The others is charitable giving. While in the United States, in the last 3 years, charitable giving has increased. For our local area, charitable giving has decreased. And that's just the nature of where we are. It's not because people aren't generous and aren't giving. It's because the way of being able to give has changed, and we haven't caught up with that way of giving yet. So we as an industry need to catch up on that. Also, government grants are generous, but they're also decreasing in the areas for nonprofits as well. And I don't have to tell you all this, but the cost of living is increasing. I have applications come through all day for Alice to help with rent and mortgage assistance. A 2-bedroom apartment now is about $1,800. And that's what normally we're seeing. And these are for individuals that their pay hasn't increased in the last year or so. And then the other is, trends that are happening, the staffing shortage. That's it. Anybody experiencing that in the room? No one's raising their hand. That's good.
It's because I'm behind you.
Okay, thank you, Dr. McDermott. The other issue is underemployment, and this impacts us as employers, but also us as nonprofits in the industry. That underemployment, there are more jobs, but there aren't enough full-time jobs with full-time benefits that pay health coverage, paid time off, things of that nature. In Virginia, over 50% of the jobs in Virginia pay under $15 an hour. Now that may have changed since the minimum wage has gone up, but the last Alice report reported that. So it's hard to get those jobs that can help people maintain a living. And then the other, we're just experiencing with the nonprofit industry as well, and we don't know the impact of this, is learning loss. I have a senior in high school, and this is his first normal year of high school. 9th grade, COVID hit, and he went out of school. This is his first normal year. So we don't even know the impact of learning loss, and then the impact it's going to have on employment. But we have good news. We have data. At Rappahannock United Way, we have the Alice report, and the Alice report is updated every 3 years. And in May, we're getting a new Alice report to tell us where the needs are, so that as donors, they know where to put their dollars, and as employers, you know how to help your employees and where to help people the most. So one of the questions was, what strategies do you have in place for your industry? For us, we're bringing the Alice report to Virginia in May to let you know more about what employees need in order to survive. The last report reported that in one of our counties that we have, for a family of 4, 2 working adults, an infant and a child, in daycare, the family needed to make $80,000 just for a basic survival budget. And so we don't know what that what that number is going to look like. You had extra time, right?
Yes.
Thank you. Thank you for the opportunity to share. I wish I had more positive information to share, but it's hard times, and we need to come together as a community to solve those times. And who better to do that than the chamber?
Thank you.